So today we're continuing to talk about the warm weather precautions that should be taken as we support people enjoying the outside activities. So the topic for today is hydration. So fluid loss, as we know, is typically greater in warmer weathers because our body is sweating to try to keep us cooler, especially if we're participating in physical activities or we're very active. And maintaining proper body fluid levels is essential. And again, some people with intellectual and developmental disabilities aren't able to communicate that they're thirsty, that they'd like some water, or maybe they aren't able to access it themselves. So it's very important that people who support people with IDD are aware of proper hydration. So we should always encourage fluid consumption regularly and more frequently in hotter or warmer conditions. And if a person doesn't like to drink as much, there are other things that you can use, like popsicles or snow cones or frozen juices. These things can be more enjoyable for a person and can also help maintain hydration. Did you know that there are a number of fruits and vegetables that have a lot of water? Things like watermelon and peaches and plums and salad greens, and there are a few others, have a high water content. And snacking on these things when you're outside can help maintain good fluid. And, if you know you're going to be out in a hot area, and the person is at risk for losing a lot of fluids, you might try encouraging a lot of fluids before you actually go out, so you start off with a higher fluid level as well. Now, there are, dehydration is a thing that we really worry about, and some of the signs of dehydration include sunken eyes, where their eyes just appear to be sunken into the head, skin tinting. So normally when you pinch your skin, it goes back to normal within 2 seconds. But in a person who's very dry, if you pinch their skin up like this, it might stay in that tinted position for several seconds. That's a sign of dehydration. If a person is crying and isn't making any tears, if their urine becomes very dark, or they don't have very much urine, and certainly if there's a change in level of consciousness, those things are very serious and really big signs of dehydration, and you should seek medical attention right away. So we're going to continue our discussion on warm weather precautions in our next edition of Medical Monday.